So, for most of our patients, you'll just simply twist off the mouthpiece and put the mask on. Now, one trick is you actually, with this piece, this 45-degree angle piece, you actually want to flip it 180 degrees, and that'll allow the neb to be straight. Otherwise, it ends up being sort of upside down, and it sits like this on the patient's face, so it's not actually going to nebulize appropriately. So flip it that way. Your medication goes in here. Screw it back on. In the neb packet, there's also a tube. One part of the tube goes into the bottom of the machine, and the other piece of the tube connects to the oxygen, which in the ED are the green probes. And you need to turn it on to at least 5 liters to get the medication to vaporize. So as you can see here, when it's turned to the dotted arrow, nothing is coming out of the mask. But when I switch it over, it may be hard to see, but you can actually see the steam coming out of the nebulizer. For the mouthpiece, that's actually a setup for a BAN, or breath-actuated nebulizer, which means the patient has to generate a negative inspiratory force to get their medications. Most of our patients don't really like the BAN. It's the preferred method for the asthma room because when they're using the BAN, they get every bit of the medication that's in the tube. If they're not using a BAN and using a mask, half of that medication is constantly escaping. But however, most of our patients, again, do not prefer the BAN. They like the mask. To use these, what you'll do is unscrew the top. Your medication goes in here, so that tends to be albuterol and Atrovent. Screw the top back on. Now you'll see the top with the green button and these 2 arrows. When the button is turned to this arrow with all the dots on it, that's a setup for a BAN. So